Types of second heart sound S2. The second heart sound S2 is produced by closure of the aortic A2 and pulmonary P2 valves at the end of SIF1. Normal physiological splitting. During inspiration, increased venous return, delays, closure of the pulmonary valve. A2 occurs first, followed by P2. Splitting widens during inspiration and narrows during expiration. Commonly heard in healthy young individuals. 2. Wide splitting. Splitting is present during both inspiration and expiration, but becomes wider with inspiration. Causes: right bundle branch block RBBB, pulmonary stenosis, pulmonary hypertension, early severe mitral regurgitation. 3. Fixed splitting. Splitting remains unchanged during inspiration and expiration. Classic cause: atrial septal defect, especially secundum, ASD, due to chronically increased right ventricular stroke volume. 4. Paradoxical reversed splitting. P2 occurs before A2. Splitting is heard during expiration and disappears during inspiration. Causes: delayed aortic valve closure, left bundle branch block LBBB, severe aortic stenosis, hypertrophic cardiomyopathy, left ventricular pacing. 5. Single S2. Only one component is audible. Causes: severe aortic stenosis, soft, absent, A2. Severe pulmonary stenosis, soft, absent, P2. Pulmonary atresia, truncus arteriosus. Severe calcific aortic valve disease. 6. Accentuated loud S2, loud, A2. Systemic hypertension, dilated, ascending aorta, loud P2. Pulmonary hypertension. 7. Soft diminished S2, soft A2. Severe calcific aortic stenosis, soft P2. Severe pulmonary stenosis.